Hello, I'm Naomi. I'm Professor of Healthcare Management at Manchester Business School. I recently published a paper in the Journal of Health, Organisation and Management on healthcare board governance, and just wanted to run through the main themes coming out of that paper. It was prompted by the Francis report into the failings at the hospital in Stafford in the United Kingdom, and the failings particularly of the board. The paper that I have written summarises the current state of research on effective boards. Just to run through 4 points really, to summarise what we found out so far around structure, focus, dynamics and context for boards. On the structural side of things, unfortunately, there isn't one structure for boards that works in all cases and in all circumstances. So when people ask me what's the correct size for a board, there isn't a simple answer. There can be examples in the public sector where boards are too large, and in the private sector where they're too small in order to undertake the necessary functions of control and strategy. There are indications, however, that there are certain structures that are more conducive to high-performing organisations than others. And one is diversity of thought and indeed diversity of gender. There is a building business case now for gender diversity on boards, building evidence that women on boards is associated with superior organisation performance both in the public sector and also in private sectors. The role of non-executive or lay members or outside independent directors is also coming to the fore, with growing evidence that non-executive directors who contribute more, who exercise grip, who have some expertise in the industry or in the sector is also important. Moving now on to focus for boards. Garrett talks about 4 principal tasks for boards, which is setting strategy, identifying choices, investment choices, monitoring performance and accounting to shareholders or stakeholders. The evidence is that most boards spend too much time monitoring performance and not enough time on setting strategy or making those very difficult strategic choices. They are also quite weak, quite often, in accounting to stakeholders or shareholders. But the other thing that effective boards of effective organisations do is to keep a very close eye on managing talent, identifying talent, progressing talent for their organisation, and focusing on identification and use of resources for the organisation. The third area I wanted to touch on is in terms of dynamics, and again the important thing for boards is to be able to have difficult conversations but without an aftertaste, and this is what we begin to describe as high trust but also high challenge. So it's a combination of what some people would call an agency and a stewardship model for boards. Agency is very demanding, very challenging, requiring compliance, but stewardship is actually we're all in this together and I'm going to support you as well as challenge you. The other aspect of dynamics, though, is the increasing need for boards to be close to their organisation, to be able to hear when their baby is crying or when their baby is not well. And that actually means that boards need to exercise a strong grip rather than to remain distant, which can so often happen. So we're beginning to build this triadic proposition of high trust, high challenge and strong grip. Finally, I wanted to come on to something around context and circumstances. There are circumstances when a board may well want to behave in a different way. When there's a crisis, it may well be that the board needs to delegate to their chief executive or their director or their managing director or whoever it might be who's the executive in charge, most responsibility for turning that organisation around. That can be called managerial hegemony. The thing is to watch for that not persisting once the crisis has passed and not allowing that chief executive to have too much power. Also, and this is relevant to the health sector, there may be an argument in new start-up type of organisations as there are in industry, to have actually a relatively light touch. And that's where the clinical commissioning groups in England, probably more by accident than by design, may be configured appropriately by only having 2 lay non-executive directors on their boards, allowing the doctors and the other clinicians a little bit of headroom to develop their thinking, develop into their roles, take some power and control. But actually, as they bed in, the boards will then maybe need to control them a little bit further. There may also be circumstances where the board needs to exercise very tight control, where the organisation is dipping in performance, and that's where the control and monitoring function of boards comes to the fore. What they need to realise is circumstances when actually that can be deleterious to organisational performance, and they need to focus much more on rates of innovation and encouraging that. So, as ever, it's a balancing act. It's an art as well as a science, but there are some clues as to more and less effective board work.